Victoria in 2008 is that a bill was passed called the Abortion Law Reform Bill, which legalised abortion up to birth with no right of conscientious objection for doctors or nurses or health professionals. Many of my colleagues after that left Victoria because they felt ethically they could not work in a state that would force them to kill unborn babies, either deemed an emergency, which was not very well defined in terms of having to be involved in performing an abortion, or participating in arranging an abortion through a referral, which the Victorian Abortion Law Reform Bill says is necessary to comply with the law. It forces doctors or nurses to be involved. It's also being proposed in other states, including Tasmania and New South Wales. It is a fundamental human right that we have freedom of speech, that we have freedom of conscience, that no worker should ever be forced to be involved in the killing of another human being. Why then do we have a law that has been passed in Victoria that has been proposed for other states when it is a breach of fundamental human rights, but it also removes support from women with an unplanned pregnancy who would like some independent counselling and support, who may choose to go to a pregnancy support centre where there are counsellors there and they can be offered alternatives such as practical help, financial assistance, look at their education and ways that they can still have a good education and finish their career without being forced to have an abortion. We know that over 70% of women are pressured or coerced into having an abortion. A lot of them feel they don't have a choice. As someone who's done 20 years of pregnancy help counselling, we also know that a lot of women do experience post-abortion trauma, or they experience different symptoms of grieving, of guilt, of nightmares, and physical complications for many of them, particularly when they're trying to have a subsequent pregnancy and complications that may arise after that. We all need to stand up for the right to life, the right human dignity, and also we need to stand up for the rights of our healthcare workers so that their freedom of conscience is protected. In Tasmania, not only are nurses and doctors under attack in the current legislation that's being proposed, but also counsellors, also people who want to make a peaceful protest, are all being made to feel that they are criminals. So now is the time to act, be informed, and try to really make Australia a better place by really respecting people's rights.